Greetings, my name is Michael A. Weiss and welcome to the Medical Minute. Today's show is my retort to the Sunday, November 18th, 2012, very informative program hosted by Dr. Sanjay Gupta on CNN called Deadly Dose. The show was produced to inform America and the world about the very important and dangerous problem of prescription drug abuse. While Dr. Sanjay Gupta did an excellent job, as always, of informing the public about this very real and dangerous problem, the issue that I had with many parts of the show is that it gave the impression many healthy people see the usage of opioid drugs to treat real pain under the care of licensed pain management doctors almost as dangerous as citizens' right to bear arms. People are ready to throw the baby out with the bathwater, as they say. Let me explain why I think this way. One issue I had with Dr. Gupta's show was an interview he did with a fellow physician who I believe was an emergency room doctor who unfortunately had seen way too many tragic situations involving people who overdosed on prescription drug medications. This particular doctor equated the entire problem to what he referred to as, quote, the McDonald's phenomenon. And then he went on to elaborate. In other words, people want instant gratification, and that leads them to take these pills. Now, I think what he really meant was that people who want to get a high or get away from things, they take a pill and they're instantly taken away. But what he didn't really think about was that people with real pain, like myself and others who suffer from much more serious diseases, they want instant gratification from their pain. I mean, had that doctor ever experienced a bowel obstruction? Does he know what that feels like? It's like child labor pain for 18 hours, and sometimes your abdomen can burst. That's what I go through with Crohn's disease. But to say that the McDonald's phenomenon is what's causing this problem is an irresponsible statement. I feel like I need to counter it with what is the real-life situation of people in pain who the term instant gratification is a good thing. Why should we suffer more? There was a clear assumption that pain is objective, as if certain drugs are only to be used for people who are unfortunately suffering from cancer or facing end-of-life choices. Now, I understand that pharmaceutical companies invent drugs for these purposes, but these wonderful pain drugs have come to help people like myself and other people who fight with chronic illness and can only live somewhat of a normal existence due to the relief they get from these pain drugs. So therefore, to say that some pain is worse than other pain is not fair. Now, I know that they have to devise